Ko huki Koviti hongfu mahiwa Pfizer kua aonga moe hauhau mitaki mai tau tangata Niue. Mai ke huki whakangata koe Pfizer ke puipui a koe mai he moko ngangao Koviti hongfu mahiwa. Ka eke ko molea ki lunga he hongfu maono e tau hao he moui, whakamau hawahi ngoa ke moua e huki whakangata nei. Vilo atu ke he numela whātaha nakai, po ke whinatu ke he whalenga ngao Niue Foou. Tohia hawahi ngoa ke huki. Ka auloa ke puipui a Niue mai he Koviti hongfu mahiwa.
The COVID-19 Pfizer vaccine, which is preferred for the people of Niue, is safe and effective. The Pfizer vaccine will protect you against the virus. If you are 16 years and over, please register for the COVID-19 Pfizer vaccine today. Simply call 4100 or visit the Niue Foou Hospital. Join the fight against COVID-19. Register today. Stand united to protect Niue from COVID-19.
Whalawhalahi atu, and welcome to this series of Niue Foou Hospital Muiolala podcast for COVID-19. Guys, I'll leave it to you to introduce yourselves.
Yeah, whalawhalahi atu. I'm Guzara Mokoya. I'm also the Principal Public Health Officer. At this point in time, I'm also Acting Director of Health.
Whakalawhalahi atu, everyone. Appreciate the moment that has been given to us. Leroy, very good to see you. Griselda, very good to see you as well. My name is Manu. I'm one of the doctors here in our hospital. Once again, it's just a pleasure to have this opportunity to reach out to everyone in the community. So thank you very much, guys. Pleasure.
Thank you. I know you two have been working tirelessly for the COVID-19 response here in Niue, frontline, and also in discussions, planning and preparation. Especially now we are leading up to the COVID-19 vaccine rollout. So I guess the burning question is, why is it important that we vaccinate people here in Niue?
For the past, 8 weeks, we have been continuously working with the Ministry of Health of New Zealand just to get our background information on the importance of why we should get vaccinated. But I think when we first dived into this project, the thing that we had in mind was to protect the children as well, because we all know that the Pfizer vaccine is only just for the 16 years and over. So if we are able to vaccinate everyone in that age group, which I think is around 1,200 people on the island, then we are in a better position to also provide herd immunity for our kids. Another thing that we had in mind was so that we, once everyone is vaccinated, we would also get an opportunity for our specialists to come back to the island and run our clinics, because we do have a lot of patients at the moment who needs to be seen. And we also provide a better coverage for those with underlying medical conditions. Yeah, so those are some of the things that we have already taken into consideration when we decided that Niue would get the COVID vaccine for the island.
So it was endorsed in March, I think, by the Niue government that Pfizer and biotech was the vaccine that Niue would be using, right? You mentioned herd immunity. Dr. Manu, are you able to talk us through herd immunity and why it's important for the vaccination?
Yes. So herd immunity is the cover that those who are vaccinated offers those who aren't vaccinated. And this is a small population or a small percentage of our population who will not be vaccinated simply because the tests have not said that the vaccine is safe for this age group, and the age group that we're looking at are our newborns all the way up to our 16-year-olds or 15-year-olds, and then 16s and up we can vaccinate. So herd immunity looks at providing protection to children who aren't vaccinated because they are not eligible for the vaccine. If I could also touch up on what Zelda had also spoke about, protections or vaccines for protecting our people. It's also to give the person an ability to fight the COVID-19 illness. Although the vaccine tries to prevent the infections, there are information out there that says that they will be better prepared to fight the illness. So it will not protect you from getting it, but it will help you survive the infection. So with that, it also is important for us to say that the vaccine still does not prevent someone from bringing the virus across to our country. It's also a very important factor we have to consider with this vaccination program.
So there is an emphasis on collective protection,
Yes.
for communities, and I
Yes.
think for the Niue context is very important as well. Thank you for that. Can either one of you two explain the process for Niue vaccinators to administer Pfizer here in Niue?
Like I already said, we've already been in contact with the Ministry of Health of New Zealand, and the guidance that they have provided us is that all the health professionals who are designated to be the vaccinators would need to undergo training. So we are ready to start on that training next week. So the training is for 5 hours online, and following that we would also need to do another session for the practical component of that training. So at the moment there are 7 of us vaccinators who have been certified previously by the Immunisation Advisory Council of New Zealand 2 years ago. So it's just revision for us now specific for the COVID vaccine for the deployment. So that assistance has already been provided by IMAC, and we are also privileged to have the opportunity to work with our colleagues at World Health Organization, who has also provided us with that guidance.
So from the patient or the client's perspective, what will your advice be for them leading up to getting vaccinated? I'm sure there's consent and registration
Yes.
process in place.
So leading up to the vaccination process itself is a lot of hard work as well, where we go out to the communities and discuss or give them the information that they would need to make up their own minds and sign the consent so that we can administer the vaccination. Vaccinations here on Niue are voluntary. We cannot force you to come in, but we would encourage you to come in and get vaccinated, because at the end of the day, it's to protect yourself and those that you love, especially the ones that we can't vaccinate. So vaccination process is registering with the Niue Foou hospital. That gives us an idea of how many of the population that are willing to get vaccinated. Following the registration process will be the consent signing part, where we present you a legal document that says that you are willing to go through the vaccination process, and we discuss things like side effects or the risk of something bad happening, all that will be given to you before they sign the consent. So it's a big process, but something that we need to sit down and discuss with a client who's willing to come in for the vaccination.
Yeah, so in addition to that, with the consent and things, Niue have decided that we will roll out our vaccination program within 2 weeks. That's the time frame that we have. So initially it was just 5 days, but we found that it would be a little bit rushed for the vaccinators to carry it out, especially when you're covering 1,200 people required for the vaccination process. So we've decided that we would go with the 2 weeks, mainly so that we would also give our health professionals some time to have a break and then continue, because there's 2 doses required. So the first initial dose you will receive, and then the second one you will get it after 21 days. Yep. So if we're going to do it in 2 weeks, the first 600 will be vaccinated in the first 4 days, and then gives us about 4 days to re-prepare for the second week, for the second 600. And that would come to 1,200. So 21 days after that, we will give everyone the second dose of the COVID vaccine.
Yes. So 2 rounds of vaccinations.
Yeah.
Two.
Yes.
2 rounds, yeah. So the first people who's going to receive it would be the borderline
Frontline
workers,
Yes.
the frontline workers and their immediate families, as well as the health professionals, and then we'll start with the villages.
Yeah, sounds like a lot of work, and I acknowledge you two's efforts.
Wow, it's a team effort where everyone plays a role, and if someone needs help somewhere, we're always free to jump in or try to help anyway. But yes, it is a lot of work.
Yeah, so at the moment also we have already had some discussions around how the actual process is going to pan out for us, and that is we already have people in teams as well. We've decided that 4 people will be the vaccinators, 3 will be the ones to withdraw the vaccine, because the process is quite tedious, and some people will be doing the checking again of the consent forms, and you will be required to wait 20 minutes after the vaccination. And there's a team also who will be doing the observation, and they will give you the confirmation for the next dose of the vaccine before you go home.
Ko huki ko visi hangfuma hiva Pfizer kua aonga moe hauhau mitaki mai tau tangata Niue. Mai ke huki whakangata koe Pfizer ke puipui a koe mai he mokonga ngau ko visi hangfuma hiva. Kaike ko molea ki lunga he hangfuma ono e tau hao he moui, whakamau hawahi ngoa ke moa e huki whakangata nei. Vilo atu ke he numela whātaha nakai, po ke whinatu ke he whalenga ngau Niue Foou. Tohia hawahi ngoa ke huki. Ka auloa ke puipui a Niue mai he kovisi hangfuma hiva.
The COVID-19 Pfizer vaccine, which is preferred for the people of Niue, is safe and effective. The Pfizer vaccine will protect you against the virus. If you are 16 years and over, please register for the COVID-19 Pfizer vaccine today. Simply call 4100 or visit the Niue Foou hospital. Join the fight against COVID-19. Register today. Stand united to protect Niue from COVID-19.
So, do you guys want to share with us and elaborate more on how the Pfizer vaccine works?
Pfizer is one of those vaccines in a group of vaccines. They all sort of work the same. And the idea behind the vaccine is to stimulate your immune system to be able to handle the infection once you come into contact with the real thing. So the idea is basically to stimulate your immune response, or get you to build your own soldiers to fight this war, or this battle with the COVID virus. Yes, in a nutshell, that's basically what it does. This vaccine is not a live vaccine in the sense that you will or may develop the infection. So it's a part of the virus. I've come across clients in the hospital who have asked this particular question. So it's out there in the community that people are wondering, they're worried about the type of class this vaccine fits under. So this is not a live attenuated vaccine, it's just a portion or memory portion of the virus that we use to trigger the immune response. So basically just getting your body to develop its soldiers so that it can better handle the illness or the virus when you do pick it up.
So, Doctor, in the relatively short period of time this vaccine was developed, it has shown that it is safe and effective and offers protection.
Yes. So in the sense of it being quite new, yes, there is still quite a lot of hesitancy amongst the people out there as to how to respond to this vaccine. Is it safe? Should we take it? Is it effective? And efficacy is not just how well your immune system responds to it, but it's also the side effects that this one brings up. So, yeah.
Yeah, so far, the reports that we have received from our colleagues from MOH New Zealand is that majority of the ones who've already gotten vaccinated, they only just got like redness around the injection site and just a little bit of pain on the muscle, but nothing as severe as yet. But those are some of the things that we need to take into consideration when we roll out our program. In the event that something does happen, then we should also prepare ourselves.
So just
Yeah.
leading up on the side effects as well, most of the data that's out there says that after the first injection, your side effects are not as bad as the second one. I know that sounds scary and a lot of people have responded in that way, but in actual fact, the worst case scenario with the side effects that we should be expecting is a flu-like illness, cough or cold, runny nose, body pains. And most of these happen after the second dose of the vaccine, most of which are manageable. Plenty of rest, keeping hydrated, Panadol, having those on standby to better manage the side effects when they come on. They are, in a lot of ways, a lot more better to deal with than having to fight the actual infection itself. After the first dose, you get those joint pains with the site at which you were injected, but again, they're all manageable. Yes, and they're always after the second dose.
I noted you mentioned post-vaccine observation, so that's a really important part, as well as the screening prior to.
Yeah, so in addition to the consent form that we're going to be giving for the general public to get their consent for the vaccination, we'll also be doing the screening before they come to get their shot. And after that, we also do another round of screening before the person goes back home. So the last stage of that process is there will be some officers who would keep track of all of those who have been vaccinated in case they develop anything. So the monitoring is also very important post-vaccination.
So screening that Zelda was talking about was also looking at how we can minimize the risks of some of these more serious side effects that we entertain with any other vaccine, really. And these are looking at people who are on blood thinners. Part of the screening process is to make sure that their level is not too high for them to experience bleeding, for example, after a vaccination shot. So screening is looking at ways that we can minimize the risks of something happening and setting up plans to mitigate or address these risks if the person or the client decides to go ahead with the vaccination. So we are mindful of the fact that, yes, although we're delivering a program to everyone, we also have to deliver or expect things to happen. And when they do happen, if they do happen, we have plans in motion to address them. So our plans are pretty comprehensive and catered to a lot of things. So 20 minutes after the vaccination processes, we have that station where we will observe and keep an eye on someone to make sure that none of these things happen immediately after the vaccination processes. So everything's sort of in place.
One of the advantages is that we're rolling it out at the hospital, so we're close to the facilities we need in case anything happens.
So that's one of the reasons why we decided that we would run it at the hospital, so we have everyone on board, as opposed to just a small group of the health professionals going out into the community. So I guess having it on site, it gives us that advantage because all of our equipments are also on site as well. Yeah, and in addition to all of the other discussions insofar as the adverse events are concerned, we also have, as a country, we also have an obligation to report to those who manufacture the vaccine. So they're also keeping an eye on the effectiveness of the vaccine once it gets to the country in which they have served, so that we can roll it out properly. We also need to take into consideration the cold chain of the vaccines. So that's the difficult one for us because initially the vaccine needs to be stored in ultimate cold temperatures. But now with ours, is different in the sense that when we do get it, we are fortunate that we can store it at 2 to 8 degrees Celsius. We have also we are going to get our fridges, the vaccine fridges, accredited. So that's also another thing that we have left to do apart from the training of the vaccinators, to allow us that opportunity to get the vaccines so that we can roll it out.
Yeah. So just leading on from what Zelda said, what you mentioned about the cold chain allows us to hold on to the vaccination for a certain period of time. This vaccine is very, very fussy, for lack of a better word, in that it can't survive outside these temperatures. At 2 to 8 degrees Celsius, I think we have about 2 weeks to hold on to the vaccine, which is where our 2-week runtime for the vaccine came from. So it allows us a little bit of flexibility with running the vaccination program and not too time constrained.
So the dry run would give us an opportunity to test all of those different stages in our plan. They will be providing us with those resources that we would require for the dry run before we do the actual rollout. Yeah.
Mm-hmm. So a walkthrough is really important.
Yeah.
Just a layman's question. The injection site for the vaccine is on the arm, right?
Yes.
Yeah, okay, because intramuscular.
Yes.
Yeah, so it's just like when we give the flu jab as well. So it's the same principle.
We touched upon efficacy of the vaccine and talks about how effective it is. So having the first dose is not as good as the second dose. And we can reach about 95% effectiveness, meaning you're covered about 95% of the time. 7 days after the second dose. So it just speaks to how effective it is and how committed we need to be with the vaccines. We need the first one, we need the second one, and we need to wait 7 days before it is that effective to offer us the best that it can.
Ko huki Koviti hangfuma hiva Pfizer kua aonga moe hauhau mitaki mai tau tangata Niue. Mai ke huki whakangata koe Pfizer ke puipui a koe mai he mokonga ngau Koviti hangfuma hiva. Ka eke kua molea ki lunga he hangfuma ono e tau hao he moui, whakamau hawahi ngoa ke moua e huki whakangata nei. Vilo atu ke he numela whātaha nakai, po ke whinatu ke he whalenga ngau Niue Foou. Tohia hawahi ngoa ke huki. Ka auloa ke puipui a Niue mai he Koviti hangfuma hiva.
The COVID-19 Pfizer vaccine, which is preferred for the people of Niue, is safe and effective. The Pfizer vaccine will protect you against the virus. If you are 16 years and over, please register for the COVID-19 Pfizer vaccine today. Simply call 4100 or visit the Niue Foou Hospital. Join the fight against COVID-19. Register today. Stand united to protect Niue from COVID-19.
What will be your take-home message for the general public of Niue in regards to our vaccine rollout?
I think the purpose of doing all of this awareness is for us to encourage everyone who are eligible to be vaccinated to come forward and getting registered, so that we can have a fair idea of the total amount of people that we would need to be vaccinating. But most preferably, we would like to encourage everyone to get the COVID vaccine once we have it made available. So we also open up to all of our families and friends who would need to get more information on what the Pfizer vaccine is, if they're unsure about anything, like the side effects, how is it going to be given, and all of the other things that they need reassurances for. Now would be the time to ask those questions. We would also make time during the actual rollout to re-explain the processes for when they come for the vaccine. We also like to encourage, how we have a tendency to access information from the net. We do that quite a lot now. I guess it's out of fear of the unknown. We'd like to encourage our families and friends that if they have questions they need to ask us, then they're more than welcome to get in touch with any of us at Health, instead of Googling things and getting even more confused. Because the important thing that we need to be doing now is to encourage all our families and friends, and even ourselves, to get vaccinated.
For me, it's really about responsibility, being responsible for your own health. We heard about herd immunity, and that's responsible for protecting those that aren't eligible for the vaccine. So my request or encouragement at this time, having gone through the first year of dealing with all of the heartache and the stress of having people in quarantine, which is not easy, 2 weeks away from family, 2 weeks away from home. It's a sign or an expression of being responsible for the people of Niue. So be responsible for yourself. Come in and get registered. Come in and get the vaccine. Look after yourself. And by looking after yourself, you look after those who can't be vaccinated. Looking at information that's out there. There's a lot of information out there, but it comes down to the source of your information. Where is it coming from? Is your source of information reliable? If it's not reliable, then it's most likely not going to be accurate. And we need the most accurate bits of information to make the most accurate decisions with this vaccination, with how we approach what's ahead of us. There's a lot of talk right now that COVID may be around for a long, long, long time. Be responsible and prepare, and look after yourself, look after one another, and look after our country. Source of information is just as important as that. We'll continue to have information running out to the communities. Pay attention to the radio and ads, and if you want to come in and talk to one of us, we're more than happy to oblige and spend a few minutes to iron out any issues that may come up from this or anything that you've come across on your reading. It's always a challenge, and it's always a privilege to learn something. So if you have something that you know that you're not too sure of or would like to run past any one of us, feel free to pop in. But yes, for me, the biggest thing is just being responsible.
It's good and very important that you highlighted misinformation, and for the public to access information from credible and trusted sources. I mean, especially you frontliners, Saura and Dr. Manu, being health workers. And I understand as part of the registration process, you will be doing the registrations before.
Yeah, so we have already assigned people to be part of the registration process. So we are part of it. There's, I think, some of the public health staff also would be able to give us a hand. So in the next, I guess, couple of weeks, all of these information would be rolled out, giving the community reassurance of what is about to happen, and also giving them informed consent for the vaccination.
So I understand you'll be expecting to go on the radios, and we'll be rolling out posters and information leaflets and packages when patients come.
Yep, so in the next couple of days we will be ready to roll out the risk communication engagement for the community, giving them all of those information required before we roll out the vaccination. So just like Manu has said, ironing out some of the things that they're not sure about. So as soon as we get the vaccine on island, then we are ready to go.
I guess the saying "stronger together" really adds meaning to this vaccine rollout that you guys are preparing for.
Yeah. So we're fortunate with the assistance that we've had from our colleagues outside of Niue. So mainly Ministry of Health of New Zealand, World Health Organization, Secretariat of the Pacific Community, and we've also had the opportunity to work with our colleagues at UNICEF. So they've also come to the party to give us a hand with the development of all of these risk communication packages that we are going to have ready and giving it out to the community.
Yes, it's good. Did you consider our limitations in terms of capacity and capability? But I think the public is assured of your hard work and efforts. So that brings us to the end of our podcast. Once again, thank you, Kusaura and Dr. Manu, for joining us for this podcast. Yeah, whakauelahi.
Whakauē.
Whakauē.
Whakauē.